First things first, we have 3,560 cases of coronavirus. That's 216 new cases since yesterday. The numbers, once reconciled, it's a net increase of 181 on the total. There were 35 that have been reclassified. 30 of those 216 are connected to contained outbreaks or complex cases, and 186 are under investigation by our massive public health team. There are 49 Victorians in hospital, and 15 of those are in intensive care, and I'm very sad to have to inform you that a further death has occurred, a gentleman in his 90s, overnight. I'm not in a position to provide any further details other than to say it was a gentleman in his 90s, and he passed away in hospital since we briefed you yesterday. We send our thoughts, our prayers and best wishes to his loved ones. We know this will be an incredibly difficult time for them, and any and all support that we can provide them, of course, we will. There are 1,249 active cases. In terms of tests, there were 25,730 tests done yesterday. That takes us to a total of 1,095,219 tests. Let me again take this opportunity to thank every single Victorian who's come forward and got tested. That's critically important to knowing where the virus is, to doing everything we can to contain it and limiting its spread. We did, and we've indicated consistently that things would most likely get worse before they got better. We will see more and more additional cases. That's the nature of these things. Steps we've taken this week as a Victorian community won't be reflected in the numbers till next week and the week after. That's just the nature of how this virus moves. Can I say, having driven in on the Monash Freeway from my home this morning, it's very, very noticeable that there is but a fraction of the traffic on the roads. Moving around, I've got reports from shopping centres, from the CBD, from all manner of different places. I want to thank every single Victorian for doing the right thing, for making sure that they're in their home except when they absolutely need to be out, and only ever in accordance with those 4 reasons. It's so important if we're going to contain this. If the strategy is to work, then every single person who will benefit from that strategy needs to be a part of that strategy. And that involves sacrifice, I know, frustration. Nobody is enjoying being locked at home except for those 4 reasons, and again, only when you need to use one of those 4 reasons to go out. It is frustrating, it is challenging, but the strategy will be successful if we all play our part. And I know that that's asking a lot of Victorians, but it's everything from very simple things like hand hygiene, all the way through to, if you are sick, please don't go out, please don't be using one of those 4 reasons. The only thing to do if you've got symptoms is to come forward and get tested, and the Minister can speak to some additional test sites that we have stood up or are in the process of standing up. We have more test sites than we've ever had. We're processing day on day more tests than we've ever processed, and that's because Victorians are coming forward and getting tested. And I just again say thank you so much for making that important contribution in our collective fight against this virus. Without that data, without that sense of where the virus is and how it's moving, you simply can't get to the people who are positive, you can't get to their close contacts, you can't then put in place a strategy to have them isolated at home, and indeed you can't stop it spreading to the point where many more people will become gravely ill and will need hospital care, and we know what that means. Once those numbers grow in a really aggressive fashion, we know that will spell tragedy for many more Victorian families. So I know it is very frustrating, and it is not the place that we want it to be in, but it's a clear strategy. It will work, but only if every single Victorian and the whole community that'll ultimately benefit from that strategy. It only works if we all play our part. And it's the simple stuff, the common sense, just doing the right thing, the smart thing. That's how we will get to the other side of this. This is not an ordinary weekend. It is anything but that. You've got to be in your home if you're in the metropolitan Melbourne or Mitchell Shire, other than for those 4 reasons, and only when you absolutely need to leave your home for one of those 4 reasons. Of course, I'll just make the point again that the exercise reason, one of those 4 obviously, is to go and get some fresh air, to take some daily exercise. You cannot leave the metropolitan area. If you are in the metropolitan area and you can't leave Mitchell Shire beyond, as in going further into regional Victoria if you are in Mitchell Shire. That's just about trying to do everything we can to limit this getting into regional areas. We have low case numbers, and in some parts of regional Victoria no cases, but we are being extraordinarily vigilant around that issue, and again we can't do that without the support and the partnership of every single Victorian. This is a clear strategy. There are literally thousands and thousands and thousands of people working every hour of every day to deliver this strategy, but they can't do it on their own. I can't do it without you, the people of Victoria, following those rules, making sure that we all stick together and work together. As frustrating, as inconvenient, as challenging as it is, we cannot deny the reality of the situation we face, and we cannot pretend that doing anything other than following the rules will get us to the other side of this. I might now just ask Jenny to speak to testing sites, and then we're happy to take any questions you've got.
Thank you very much, Premier, and good morning. So testing, tracing and isolating cases remains a key feature of our approach in managing and containing this pandemic and this virus. And so we are continuing to put in enormous efforts to make access to testing sites as readily and as easy available to the community as possible. Ultimately, our ambition here is to provide a testing site to everyone within 10 kilometres of their home within metropolitan Melbourne and Mitchell Shire, the areas where we have a key focus at the present time. So from today, we have some new testing sites that will be open. Woodlands Waters Reserve in Mernda is commencing operation today and will be open from 9:30 a.m. to 4:30 p.m. 7 days a week. And Woodland Reserve in Tarneet will provide a drive-through site commencing on Monday, operating from 10 a.m. To 4 p.m. 7 days a week. In addition, in the Mornington Peninsula Health will commence a mobile testing service to different parts of that community from Monday, and they'll be advising the local community of locations as that van moves around. And further, Diamond Valley Sports Centre will provide a drive-through site commencing on Tuesday, and hours and days in terms of availability are to be confirmed. So there are significant efforts being provided to provide further access to sites. So we will continue to have a very strong focus on both fixed and mobile testing sites. We now have more than 150 different testing locations available right across Victoria. So in terms of those testing numbers the Premier talked about, we've now reached 1,095,219 tests, more than 25,000 tests since yesterday. And in terms of our testing rate per 100,000 people, that is now 16,606. So I want to thank Victorians who continue to present to be tested. It's incredibly important that that Victorians do get tested even if they have very mild symptoms. As we've explained many times before, you can be infectious even before you exhibit any symptoms whatsoever. So at the first sign of very mild symptoms, you should present so that you can take the appropriate steps. I want to take this opportunity to thank my interstate colleagues who are assisting us with pathology capacity. We haven't had to send pathology samples from our public health services up until recent days, but certainly our private labs in Victoria have made use of their sister labs in other states, particularly in Sydney, and we're grateful for their support. In terms of contact tracing, I want to take this opportunity to thank our public health team that is working night and day, 7 days a week, to follow through all of those contact traces. It's a very strong team of 1,300 people. We are also utilising the support of our interstate colleagues as well. I spoke to my counterpart health ministers on Thursday. We have a regular catch-up and express my gratitude to them. Some of those individuals are doing that work remotely from their home cities, home states, and some have come to Melbourne to assist us as well. So So in terms of 1,300 strong team here in Victoria, we also have about 300 that we're utilising from those interstate counterparts, and we are in the process of growing our contact tracing team further. As a government, we have never hesitated to put in the resources that are needed to support our efforts in this pandemic. Our hospitals are well prepared. They have been working since January to respond to this pandemic. Even when the numbers came down, they never paused their efforts. They are well resourced and well trained to respond. We have ventilators in our warehouse. We have medical equipment in our warehouse and being distributed to our health services all the time, and personal protective equipment. 32 million masks sitting in our warehouse as we speak. So our health resources are well supported and well prepared, and I take this opportunity to reassure the community that our hospitals remain safe for them to visit. They should not hesitate to present to our emergency department if they need that support, or to call for an ambulance through 000. Please do not put off your regular screening. If you get contacted by one of our cancer services for your biannual or regular checkup, please continue to take up those opportunities. It's very important that people do not defer medical treatment. And just to reiterate that it is permissible to leave your home to seek medical care or health care, and that includes to present for testing for coronavirus. Thank you.
Good. Happy to take any questions you have.
Of the new cases, how many are in the housing flats, or can we get a bit of a breakdown?
There'll be a full Chief Health Officer release, as we normally do, a bit later on today, obviously with the volume that we're dealing with, sorting through those details and those number of cases that are being investigated. That's the kind of work that we're talking about. On the flats, again, I want to thank everybody who's involved in what is a massive task. Alfred Street obviously remains in a special set of circumstances, but in many respects it's no different to the rest of the state. And what I mean by that is that anybody who tests positive or a close contact needs to go and isolate at home, but when you've got an entire high-rise building where everybody is either positive or deemed to be a close contact of a positive case, it does present a unique challenge, and they are being supported, each and every one of those families, in terms of groceries, perishable food, all the other mental health support, healthcare, of course. There's a very big team of people that are doing that work, and I'm grateful to them, and I'm grateful to those residents across all of those impacted towers. But I don't think the others will mind me giving a shout out to the people at Alfred Street. They really are doing an amazing job in understanding the circumstances that we all confront, and I'm very grateful to them, and I'm particularly grateful to everybody who's down there literally 24/7 providing support and care.
Anecdotally, Premier, I know it's only 24 hours, but
Sure.
Have you had any indications how people are embracing that decree on the masks, and are you worried there's going to be a rush on masks and there may be a shortage?
Sure. I think the key point here is that I think it's quite noticeable that many more people are wearing masks now, and I'm very grateful to them. Again, we've just got to be really clear about this. It's not compulsory, but where you are out for a lawful purpose and you believe you may not be able to maintain that 1.5 metre distance from other people, then through an abundance of caution, and it's a low cost, high reward. No mask is foolproof. No mask will get the risk of infection down to zero, but every little bit helps. Every contribution helps, Nick, and I'm very grateful to think that many more Victorians are wearing masks. Now, they can be homemade, and the Chief Health Officer might want to speak to that. We have the first orders, noting that, again, this is not just for today or tomorrow. This is going to be a feature of our response for a very long time, particularly when we get to the other side of this shutdown. Part of opening up may well be, I think it's almost certain, that the wearing of masks, again, where you can't distance, could well be a really important feature of the next part of our pandemic response. We've ordered, we'll order up to 2 million Australian-made, and I actually believe Victorian-made. I'm happy to come back to you on that, but we're in discussions with lots of different companies. Reusable masks, and that'll be the subject of further announcements in terms of when they'll arrive, how they'll be distributed, priority groups that might get them. In the meantime, the stockpile that Jenny spoke about, we have ordered some additional single-use masks to replenish any that we use in the coming days and weeks. That'll principally be in healthcare settings, in other settings where we think that there's a really big reward. So, for instance, part of our response to the public housing towers is many people down there are potentially wearing masks as well, just to try and do everything we can from that abundance of caution to limit the number of people who have it, limit the risk that's posed particularly to vulnerable people.
When you said Alfred Street was largely all positive or a close contact, I know you can't speak to today's figures, but we saw 97 cases in the Melbourne greater area yesterday. Were they largely due to that Alfred Street tower, or can we break that down any further?
The Chief Health Officer might be able to do that, but essentially, just to be really clear, everyone in that tower is essentially being treated for the purposes of a public health response as if they have the virus. There are a number of people who do in fact have it, and there's been a massive testing program to get us to that point. But then because of shared services and because, for instance, we've got cases on different floors that seemingly had no contact with each other, they're not part of a friendship group, they're not part of family, that's where the public health team came back to us really clearly and said, look, we have to treat the entire tower as if everybody is a close contact of someone who's got it and therefore at risk of not having symptoms now but later on developing this virus. There'll be some additional cases there. We can probably come back to you and give you some more information as it comes to hand. But again, I just want to assure every single Victorian, as challenging as those steps were to take, they were the right steps to take, and there is literally enormous amounts of support being provided to those residents. Everyone is doing their very, very best. No response like that can ever be perfect. It's a dynamic environment. It's a very challenging environment in many ways, but there are lots and lots of people down there working around the clock, and they are doing their very, very best to get those residents through this. And I think there's been some coverage today around the sort of efforts that were gone to by nurses doing testing, going door to door, not just to single them out. There's been an enormous number of people from Lifesaving Victoria, the SES, Victoria Police, of course, Ambulance Victoria, nurses and doctors and others from Melbourne Health, St Vincent's, the list goes on and on. Then, of course, many, many charity partners. And again, I'm really grateful to everybody who, in such a heartwarming gesture, have donated, those who are thinking and are concerned about those that are having to go through this. I'm confident that they'll get to the other side of this, so will we. But it is very, very challenging down there.
Of those 13 cases that are linked to known outbreaks, can we get a breakdown of where they're linked from?
Essentially, we've got over 100 cumulative outbreaks now, so it's very difficult to speak to the 30 cases with each and every one of those outbreaks, but we're certainly seeing single cases in staff members in aged care facilities. That's a workforce that we have to be really mindful of. The response in each and every aged care facility is to go into lockdown for those residents and all staff to be tested, and for them to go into a quarantine period of 14 days and to have that testing before that quarantine is lifted for all residents and staff members. But it does flag the dangers in aged care facilities. Victoria's had more aged care facility outbreaks than any other jurisdiction, but we haven't had an aged care facility that has had a really substantial outbreak, and I think that's in large part because we've had that really early, robust response in terms of testing everyone and going into a lockdown. But we are getting more and more cases in aged care facilities, and we need to keep up with that in terms of making sure that we're doing all of the testing and quarantining everyone and transferring residents who are positive to hospital as required.
Are you concerned by the number of school-aged children who are contracting the virus?
Certainly the Al-Taqwa outbreak had a lot of school-aged children. It's our biggest cluster of cases. The risks there were both in school and out of school, and the physical distancing that was occurring at school wasn't ideal. So I'm absolutely mindful of the risk with kids in school, but as there's a return for year 11 and 12 students, that will be reinforced very, very strongly by the Department of Education and Training, the exclusion of unwell children, the temperature testing of kids, and to the extent that it's feasible, the distancing of kids within the classroom.
So the distancing, was that particular to Alfred, when you say the social distancing is not adhered to? Is that particular, or is that because it schools it through?
Look, I think it's a challenge in any school, but it's a very big school, Altaqua, and I think it became a particular challenge in that setting as well.
Has the government turned to the private sector for help with contact tracing despite repeated offers for help from the ADF, and will the government be calling on the military for help?
So, yeah, sure.
Thanks for your question very much. We have 1,300 people that are in our public health team. That's more than has ever been the case. There are 300 plus people from interstate, many of whom are very senior public health physicians who provide coordination support, deal with some of the more complex cases, and we're deeply grateful to our interstate colleagues for giving us that additional capacity. Of course, even at 1,600 though, with the number of positive cases we've got, the number of close contacts, and the fact that this is going to be with us for months and months, just as we had a partnership with the private hospital system, one that I think served us very well, we're looking to extend our partnerships with a whole range of private businesses. If you need call makers, then you go and speak to people who run call centres. That is just a logical thing to do. And the private sector has been part of our response. They'll continue to be part of our response. It is not accurate to say that there have been requests made to the ADF or offers made by the ADF in relation to these very specific skills. What I can say though, and again I want to be really just crystal clear, the ADF are on the ground in unprecedented numbers. They're doing a fantastic job. Each and every request that I've made of the Prime Minister, the answer has been yes. And there is a broader offer, whatever we need. And that's why, daily almost, people are moving around the Victorian Government, double checking that we've got everything we need. And I will not hesitate to ask for any of the support that we need. I haven't to this point and I won't in the future. I can't give you an exact number update on the number of Australian Defence Force personnel that are on the ground right now moving, that is to say, in fulfilment of the detailed requests that we've made. They're not all here yet. It just takes some time for them to arrive, but we've got ADF out at checkpoints, we've got more ADF in the State Control Centre, and we'll continue to call upon them to do their job where they've got the skills that match up to the tasks that we need done. They are doing a fantastic job and I'm very, very grateful to them.
So to clarify, they did not, the ADF did not offer to do the calling? There's been no sense, Nick, that they would necessarily have the right skills to do that. This is a call centre job. Now, I don't want to get into any sort of sense of blame or any of that, right? That's just not relevant here. If I need something, I ring the Prime Minister. The answer is yes. That's how it works. If he needs something from me, the same thing works. That's just the nature of the partnership that we have. So anything we need from the ADF, we will ask for, and I would be absolutely certain that the answer will be yes. As far as contact tracing goes, just think about this for a moment. It's principally phone calls. Some of it you do need absolute years of skills, particularly for complex cases, and there are many, many of those. But there are some other functions that are more akin to call centre type work with some clinical training as well, and that's why we've been having discussions with a whole range of different call centres. That just makes sense. There's nothing more to it than that. And again, I want to make the point, this is not about what was offered and what was accepted and what was asked for. There's complete clarity about this. Where we need something, we ask, and the Prime Minister says yes. And I'm very grateful for that, and all Victorians should be, and I'm certain that they are.
In regards to people doing the wrong thing, like the birthday party we saw a couple of days ago, are you aware of any other incidents in the last 24 hours of people breaking the rules?
Not that I can speak to, no. The Chief Commissioner and the Police Minister might be able to provide you with some further details of any standouts, as it were. Look, there's no need for anyone to get fined. These rules are really, really clear. And if you do the right thing, then you won't be at any risk of getting a fine. But if people do the wrong thing, then this is so serious. The stakes are so high that the police will not be issuing warnings and cautions. The Chief Commissioner's made that really clear. That's his call, and he's made it, and I support the call that he's made. These rules are not new. We are frustratingly aware of what it takes to bring this under control, and that's what we must do, and everyone's got a part to play. And I just don't think it's too much to ask each and every Victorian only go out for those 4 reasons. I'm not asking you to enjoy it, no one will be enjoying it, but it's just what has to be done. And police are out there in force, well supported by the Australian Defence Force at checkpoints and other important functions that Victoria Police have stood up to be able to have that hard border. Every Victorian's got a part to play, and I would thank every Victorian who is doing the right thing, and that's the vast majority, and that's a deeply impressive thing. But there will always be a small number of people who don't do the right thing, and it's just, not only is it wrong, it's not very smart, because Victoria Police will catch you.
Premier, there was a case,
Sure.
I think it was a couple of days ago, of a woman who was going off to feed her horses, and she had hay bales.
Sure.
She's been fined. Do you think is that the type of
I'd leave it to Victoria Police to talk about individual cases. Again, there's a very clear set of rules, and I would ask all Victorians to play their part. And I would, in doing that though, I would again thank every Victorian who is, and that is the vast majority of people across the metropolitan area. On the specifics of that case, to the extent appropriate, I can certainly get Victoria Police to come back to you, Nick.
Yeah, so I suppose the question then is that the type of thing you want people to stop doing, given she was going to feed them?
Well, what I want people to do is to go out when they need to go out, to follow the rules. There will always be cases where there's some interpretation required, and if we were just dealing with ones where there was a genuine question of interpretation, that'd be fine. But some of the examples that the Chief Commissioner cited yesterday, there's no interpretation there. That's just not the right thing to do. On the specifics of that matter and its exact status, I'm more than happy to have Victoria Police come back to you.
There do appear to be some grey areas though. Does there need to be some more discretion?
Well, whenever you make a rule, there'll always be room for interpretation in some parts. What I'm asking Victorians to do is not to spend time trying to find ways to get around the rules, but instead to follow them. We all just have to do that. We just don't have the luxury of ignoring the reality we face, nor do we have the luxury of thinking that there's some other strategy that'll just drive these numbers down, so it doesn't really matter if I'm not compliant with the strategy that's in place. That thinking will only see more virus, more cases, and a longer lockdown. I don't want to have people locked in their homes any longer than is necessary. And if people make selfish choices, then that'll mean that it won't just be for them. It isn't for them to make that judgment, because it's not just them who pays the price. We all will, because the lockdown will go longer. There is common sense used. Victoria Police are well proven to act fairly, but to be firm about it, and that's what's really, really important in this very delicate set of circumstances.
Premier, when will parents of kids under year 11 have any clarity on what their school future is going to be?
Now, as you know, Mark, we have extended the school holidays for a week. I want to be clear though, they are pupil-free days, so teachers and staff will be back at school throughout this coming week. We have always tried to give parents and school communities as much notice as possible, and some further work is to be done to settle our position on that. It'll be based on the best public health advice. It will be about making sure that nothing we do contributes or makes it less likely that our strategy works. We've got to have that abundance of caution to make sure that when I said 6 weeks, we can get to the end of that 6 weeks and be out of this. But we'll give parents as much notice as possible. Of course, 11 and 12, Year 10 students doing VCE subjects and kids in specialist schools do go back on Monday. And I want to reassure all parents that have got students in those year levels and in those settings that there will be temperature checking, there will be all sorts of different processes and protocols, just strengthening, building on the great work that our schools did at the back end of the last term. I know that school communities take this very, very seriously, and there'll be some options, for instance, for a little more distance perhaps, because we have less than a full school. We have only a small number in the overall number of students attending each of those schools, but we thought it was important and we thought it was low enough risk to justify having our Year 11 and 12s back in school, We don't want 2 VCEs, one from metropolitan Melbourne where there were much longer shutdowns than regional Victoria and vice versa. The other point too on specialist schools, I just want to again make the point that we've listened to parents of children who have those highest needs, and it's just not practical for them to be schooled at home. It's really, really challenging. So those schools are open for that reason as well. Lower risk, and really the alternative is not an appropriate alternative.
The TGA has approved a drug called remdesivir for use in Australia. That happened yesterday. Is the Victorian Government looking at that at all for the use of treating seriously ill?
That is most certainly a matter for the Chief Health Officer.
Yeah, I'm sure the Victorian clinical community will look to remdesivir as a therapeutic option. If it's on the Australian Register of Therapeutic Goods now, they will love to have it available for them, as they have used dexamethasone, that powerful steroid that's been shown to have a genuine effect on mortality rates. So remdesivir is another drug that's shown some effect, possibly not as strong as the simple and cheap dexamethasone steroid drug, but it certainly has a role and seems to reduce the amount of time that people are ill for and require in hospital. It may have less of an effect on death rates, mortality figures, but it'll be part of the armamentarium that I'm sure clinicians will look to use.
How much of that drug do we actually have in Australia or Victoria? I don't know if you know.
I don't know.
The US was stockpiling it.
Yeah, I don't know. I know that the Australian Government has looked to get its own supply, but the US really went very hard in gobbling up the entire global supply almost.
Could you talk a bit about the 2 million masks and the logistics of that, where they'll be targeted? Will residents in areas like Craigieburn and Roxborough Park, where they've had high cases, be strongly encouraged to be wearing masks when they're going out and doing their business?
Yeah, I'll let the Premier speak to the logistics of it, but just to say, certainly we would make an emphasis in those hotspot areas for the most vulnerable individuals, you know, the very elderly, those with pre-existing chronic conditions. They are ones that we are very strongly recommending, but it's a recommendation for everyone in Metro Melbourne and Mitchell Shire at the moment, and it's a consideration for anyone in Victoria, if not Australia. So I think we'll work through the practicalities, but absolutely we'll provide some public health guidance on those priority populations as well.
So 2 million reusable masks is obviously a very significant order. That's been placed. The first of those will be with us quite soon, and we'll have more to say about exactly how we're going to get them out to people. We want to make that process as easy as possible. The notion of these things, the way they work obviously is you wear them where you're not confident that you can maintain that 1.5 metre distance. You wash them, you can wear them the following day, the day after that. This is a much better way of going than the vast quantities that would be required if you use single-use surgical grade masks, and even they are not 100% risk-free. They've got to be preserved for those really high-risk environments like hospitals and other parts of our healthcare system. We'll have more to say about when they're arriving, how we'll get them out to people, who will be the priorities in terms of getting those masks. But the other point to make, of course, is you can make a very simple mask at home, and it does limit the risk of transmission of the virus. Even wearing a scarf and covering your face is of some benefit. But again, the Chief Health Officer, I think, if he's not yet, he's going to very soon make a video. It's made. The video is made, and I would encourage people to have a look at that. I'm sure brilliant performance to show you how simple it is to wear them correctly, because correct usage is also a really important part of this. So, sorry, that's a long way of saying we're going to come back.
Yeah.
I'll let you know in full detail where they'll be, how you get them, as well as how to use them, and which communities, which groups will be the absolute priority.
So there's no estimated time of arrival when they might?
When I have more to say about those matters, I will. And in the interim, there are surgical masks, and that's the point I made before. We've also ordered a number of other surgical masks, single-use masks, in order to replenish our stockpile. If there is for instance, in the towers or positive cases, close contacts on that kind of individual basis, where the recommendation is for people to wear masks, we think that's the best way to go. We don't want to have it. If you've got a stockpile, you've got to protect that stockpile. That's not there for this part of part of the virus. That's there if things were to get much, much worse. And of course, that's in our hands, really, in terms of the way that we conduct ourselves.
Are those hotspot suburbs still driving the numbers we're seeing today?
We're still seeing significant numbers come out of those northern and western suburbs, but it is in other parts of Melbourne as well. And I wouldn't want anybody in Melbourne, anywhere across Melbourne, to think that this wasn't relevant to them. It is relevant to your family, your street, your community, and indeed all of us. So we've all got a part to play in that. But there is still a significant representation within that corridor, but it is in every part of Melbourne, some at very low levels, but it won't be at low levels for long if people don't follow these rules. And that's why, again, thank you to all of those who are doing the right thing, and a really clear appeal to those who aren't. Do the right thing because it's the right thing to do, but it's also the smart thing to do, because Victoria Police are out there in force.
Professor, can
Sure.
I ask you, at what stage would you expect or hope to start seeing results from the lockdown and the increased concentration? At what stage would you be looking to see, okay, we're going to have to see a flattening or a decrease?
Really, I'm hoping for it from now. We know that there were some changes in behaviour in advance of the lockdown, and that should have an effect as well. And we had a more geographically limited lockdown in the hotspot areas that's been in place for longer. So it would be great if that plateauing is occurring now. But really, with respect to the stage 3 restrictions that we've got across Metro Melbourne and Mitchell Shire, it's in the next 3 to 5 days that it should really be having an effect. There are challenges though. Those restrictions limit very substantially the number of interactions we have in our home, socially, outside, but there are people who need to go to work, and when you've got a significant pressure of infection that we have with our numbers now, we know that there'll be transmission because of the work that people have to do, and so we can't be absolutely guaranteed that that will turn around in the next 3 to 5 days. We need to work with the masks, we need to work with all of the workplaces, we need to make sure that people are doing the right thing in terms of excluding themselves when unwell and getting tested as part of that as well, because it won't just be about staying at home except for essential reasons.
Is there anything from the figures that you've obviously analysed or your staff have analysed over the past couple of days which give you optimism that we are getting close to a plateau or dropping? Is there anything there that you look at and say, yes, this is good?
Oh, the main thing is the mobility data. It's really showing a very substantial decrease in people's mobility, their numbers of interactions with other people, and we have proxy measures for that. We don't know absolutely if people are meeting someone else, but you can get information from Google in terms of driving directions, in terms of pedestrian directions, that give you an idea of how much people are moving out and about and how much time they're spending in their home, and that's all looking good.
Can you please quickly just speak to why we're still pursuing a suppression strategy rather than elimination? I mean, obviously shutting down again is horrible for businesses. The Premier's spoken about that a lot. So what's the line for us at suppression to make sure that we don't just keep entering these lockdowns even after this one's done?
It was a decision of National Cabinet. AHPPC provided the pros and cons, if you like, of suppression and elimination. As a public health person, I'd be very happy if elimination were a feasible thing to achieve, because it has its own challenges. You absolutely need to not reintroduce virus at any point once you've eliminated it, because it'll take off. But the challenges of suppression are very substantial as well, especially if a vaccine is 2 years away or 18 months or more away. So I think it's not the national decision at the moment. I would hope that as we move through this phase in Victoria and look at everything else that's occurring across the rest of Australia, that we don't close ourselves off to a re-evaluation and a reappraisal of what's feasible and what the pros and cons are.
And we've been asked to clarify, what is the situation at the moment during this lockdown for funerals?
For funerals, I understand that it's in the Metro Melbourne and Mitchell Shire, it's a limit of 10, I understand. Is that right? 5? It's 10. 10.
Will school children be asked to wear masks, or will they be encouraged encouraged to?
They won't be asked to wear masks. We know it's tricky in a school setting. We know that younger children are much less likely to transmit. They tend not to wear them as well. They're obviously engaged in lots of conversation normally, but we won't stop kids from wearing them if they individually choose to.
Are you able to say whether the death today was linked to any known clusters or outbreaks in any sense?
We're not providing additional detail on that death, I'm sorry.
You kept mentioning aged care services, but they seem sporadic. So are these just community transmissions, or how does it keep seemingly hitting at different aged care facilities?
Yeah, I mean, aged care facilities have staff who are community members, and the transmission in the community is the reason I think that staff members are coming down with coronavirus. And they're going to work. I'm not saying that they're turning up with symptoms, but some of them will develop symptoms on a shift or going home, and we take that 48 hours before they develop symptoms as an infectious period, and we therefore have to lock down the facility and we have to test everyone on that basis. So it's a danger. As long as there's significant community transmission, that anyone going to any workplace could be bringing coronavirus with them. And of course our concerns about aged care are the vulnerability of the population and the ability of the virus to spread within those settings.
And you said 14 days for anyone who's obviously tested positive. That tower at North Melbourne has got a lot of people who've either tested positive or are cases. Are they potentially looking at sort of 14 days from today, or...?
No, people who test positive can be cleared after 10 days if they are free of symptoms for 3 of those days. So you can actually, if you've developed illness, you can actually be released from isolation at an earlier period. The 14 days is for people who've been exposed to a positive case who require quarantine. So quarantine's for well people who need to go through 14 days because they could develop illness at any point in that 14 days. You can release someone when they have no symptoms and in aged care settings when they've had a PCR test to show that they haven't got the virus as well.
But for the entire tower, are they looking at another week or more?
For the Alfred Street tower, they are looking at another week to make that 14-day quarantine period come to a close.
What's the average wait?
I don't know which one this is for, but I was just asking whether, for parents who are nervous, for initially obviously the BCE, the specialist schools, and then ultimately when all schools go back, for parents who are nervous about their kids, will there be any penalties for them if they make the decision to keep their kids at home?
It's not about penalising people, Nick. I know there is significant concern in the community in terms of where we find ourselves, but every decision that's been made has been based on expert medical advice, and it is believed that having those 11 and 12s back at school is safe. There is a low risk, a manageable risk, but for an abundance of caution, we've got all those thousands of temperature guns to be able to take people's temperature, make sure that any student who's presenting with a fever, that's not the same as a test, but it's a pretty good proxy for obvious symptoms and potential illness and potential virus, and on that basis those kids would be sent home. So I think if we're all vigilant, if we all work together, then the rewards of having our Year 11s and 12s being able to push through and get to the end of the year on equal terms with Year 11 and 12 kids, not just in regional Victoria but across the whole country, I think that the reward is very high. But that'll be monitored, daily to make sure that things are as we'd like them to be. If we all work hard together, I think we can make that work. And my message to parents is these decisions are always based on medical advice. Otherwise, we simply wouldn't have the kids back.
But if the parents are nervous, though,
we're not going to be penalising people.
No, so
And look, perhaps the best way to answer it is this: there'll be a number of, not a large number, but there'll be a number of Year 11 and 12 students who, because of underlying health issues or the vulnerability of somebody in their house, for instance, they won't be going to school. I think it'll be a small number. We would always look to support them as best we possibly can. On specialist schools, again, it's deemed to be of a lower risk, and it's also deemed to be, from listening to parents, it's really tough and bordering on completely impractical to be trying to run homeschooling for those kids. So it's just about listening and trying to have a policy response that meets the needs of the people who know and understand those challenges best, and that's of course mums and dads of kids who go to specialist schools.
What's the average wait time to get a test at the moment, and has that increased? Are you worried it might be putting people off getting tested?
No, I don't think that there's anything putting people off. The numbers are absolutely bigger than they've ever been. We are doing more testing than we've ever done, and it's, you know, we've had days where we've done 25,000 and then the next day might be 10 or 12,000. The difference this time is the consistency. We're getting that 20 to 25,000 every single day. Indeed, yesterday, 37,000 tests. So there's very significant capacity there. It can grow further if it needs to. There's always time between when the test is taken and when the laboratory processes it and when the results come back. Everyone's doing their level best. They're very, very best to make that as fast as possible. So I don't think there's certainly the data would seem to indicate that people are doing the right thing. They're coming forward and getting tested, and I'm very grateful to every one of them. And I'll take the opportunity again to say thank you to everyone who's come out and got tested.
Is there an average time though for people? Because when people go to get tested, I think a lot
Sure.
of people are asking, how long is it going to be until I hear? What is the...
It's between 1 and 2 days normally.
Thank you for that question. So at the moment we are averaging between 2 and 3 days. That's because of the huge volume of additional testing that we are doing. But our capacity in our pathology labs is actually increased. We have a capacity in Victoria to process about 25,000 tests per day, and we're also utilising the additional capacity of interstate labs as well. And I took the opportunity before to thank our interstate labs for their assistance as well. So the time frame is still good. I just want to stress to individuals who have been tested that they should isolate at home until they receive that test result, because the risk is, of course, if they are positive and they continue to go to work and move around into the community, that they could infect others. This is why we've had the hardship payment, other supports available to people to make sure that there is, I guess, no disincentive to people pursuing a test and staying home and isolating if they do test as positive, to ensure that they, don't lose essentially a couple of weeks' pay, and they've got that hardship of payment of $1,500 available from the Victorian Government if they can't access their own sick leave or other workplace entitlements.
So if there's no other issues, we'll just thank every Victorian who's doing the right thing. That's how the strategy will work. That's how we will get control of this virus and drive numbers back down to a sustainable level. And I just ask all Victorians, it's one day at a time in order to get us to the end of that 6 weeks. This is not an ordinary Saturday, it's not an ordinary weekend. People need to do the right thing. Again, thanks to those who are. That's the vast majority. But to every single Victorian, we will all benefit from this strategy, and therefore we all have to play a part in delivering this strategy. Thanks very much. If there's no other questions, I will most likely see you tomorrow. All good? Thanks.